Hello and welcome to HSM 220. And for today's class, we will be discussing the implementation of ACA in Louisiana. So there are three learning objectives. The first is going to briefly describe the history of the adoption and implementation of ACA in Louisiana, and also discuss the implementation of ACA and Medicaid expansion in Louisiana, and then finally review how Medicaid expansion has happened in Louisiana in terms of score sheets, how well changes in the some health outcomes as a result of Medicaid expansion. So, beginning with the history of ACA in Louisiana. So, um, in starting with formulation, at the federal level, all the representatives of Louisiana state delegates, they opposed the ACA, and but at the House of Rep level, there was one Democrat in there that voted to pass ACA. On the state level, the then governor of Louisiana at the time that ACA was formulated had strongly opposed ACA alongside the other Republican governors as well, and had instead proposed a state-run health insurance. And however, that was not passed until at the time of the state election. So ACA implementation at the former governor of Louisiana had rejected Medicaid expansion, and but when the present governor of Louisiana got elected in 2016, he was a Democrat, and he had promised to expand Medicaid, and did so the day after taking on the office. So, what are some of the key features of ACA in Louisiana? First, ACA is being federally operated. Sorry, it's being operated through a federally facilitated marketplace, the HIE, and then in a number of health insurance providers are operating under the HIE in Louisiana. We have Blue Cross Blue Shield, HMO Louisiana, Vantage Health Plan, C Christus, and United Healthcare. So since 2016, about 214,000 people have enrolled in the Louisiana HIE. So with Medicaid expansion, before Medicaid was expanded in Louisiana, childless adults were not eligible for Medicaid coverage, regardless of what their income status is. And but after Medicaid was expanded, what happened in Louisiana was that people who were on the SNAP program were auto enrolled into Medicaid following the expansion of Medicaid. So, what happened in 2020 following the coronavirus pandemic was there was this program, the Family First Coronavirus Response Act. A policy was passed in Louisiana that provided additional federal funding to keep Medicaid enrollees covered during the COVID crisis. And however, there would be a redetermination of their Medicaid eligibility, and this will be after the end of the COVID public health emergency period, which expires May of this year. Other things that happened following Medicaid expansion includes that a substantial number of low-income people where they transitioned away from having private coverage into Medicaid since they now became eligible for coverage. And then Louisiana experienced a drop in uninsured rates from 10.3% in 2016 at the time that Medicaid was expanded till to from 16.6% before Medicaid expansion to 10.3 after Medicaid expansion. So there has been a drop in the uninsured rate. Around 2018, this number even dropped further to 8%, which was below the national average. However, during the Trump era, most states experienced an increase in their uninsured rates, and this includes Louisiana, whose uninsured rate at the time was at 8.9%. However, as of 2021, the uninsured rates in Louisiana have kind of averaged at 9.4. So this is what that looks like in terms of the percentage of uninsured in in Louisiana. As you can see, some places are doing better. There is below 9.1%, and some places are not doing so good. Hammond is around this place, and it is at having uninsured rate of more than 10%. So this is what that looks like when it comes to Louisiana. So how has ACA been implemented in Louisiana? So this is a snapshot of what Louisiana looks like in terms of ACA. As of May 2021, we have 1.7 million people in Louisiana that are either being covered by Medicaid or being covered by CHIP. As at compared to 2010 to 2019, there has been a 50% reduction in the uninsured rate in Louisiana, and there has been about 71% increase in the number of Medicaid or CHIP enrollment in Louisiana since late 2013. So as you can see, Louisiana is experiencing some increase in healthcare access, access to healthcare services as a result of, insurance coverage. So Louisiana is not doing badly in that sense. So how was Medicaid expanded? So how was Medicaid expansion implemented in Louisiana? So it started with a policy that was passed in the state legislation called the HCR 9075. So this is the House Concurrent Resolution of House Concurrent Resolution 75. This was proposed in June 2015, and what this it was passed in 2015. My apologies. So what this policy did was that it allowed hospitals to charge a fee, and this was to help get the 10% that was required for states to pay in towards the funding of Medicaid expansion. So the state senate had voted 31-8 to pass this policy. At the time, the former governor was still the one in charge, and his signature had not been required to approve this policy, and therefore it was not sought. But when the Governor Edwards was elected, he was told to expand Medicaid as at April 1st, but he expanded it even earlier than that. So another element of implementing Medicaid, the expanded Medicaid, was that you had the Louisiana Department of Health and hospital being tasked to oversee Medicaid expansion. and with that came 248 new state employees that were hired to assist in handling enrollment and managing the expansion. So Louisiana really, did its bit in terms of making the implementation as smooth as possible. So, what is Medicaid eligibility in Louisiana? So, for children, those who are below the age of 18, on an average, is 212 percentage federal poverty level. And for children whose family income is between 212 to 250 percentage federal poverty level, were moved to Louisiana's CHIP. Also, pregnant women who who had household income of below 209% were also moved to the CHIP program. Currently, Louisiana has a combination of Medicaid expanded and a separate CHIP program. So this is what that looks like in terms of how the eligibility for the CHIP and Medicaid expansion is done. As you can see, the separate CHIP program kind of picks up on wherever that is left with the Medicaid expansion and gets up to 250. So it's pretty good. So for adults under the age of 65, Medicaid eligibility begins at 138% of the federal poverty level. However, there is this thing called the Medicaid ABD, which is the Medicaid eligibility through the aged, blind, disabled pathway. So what that does is for Medicare enrollees who are receiving supplementary Social Security income, they get become eligible for the Medicaid ABD. And this is for those whose income limit is at $783 per month if they're single, and over $1,000 if they are married. And there's also a limit in terms of the assets that they have, $2,000 if single and $3,000 if married. And the Medicaid ABD covers dental care and secondary eye care, but it doesn't cover the routine eye care. So it does provide an additional coverage for people who are on Medicare who are eligible for it. So how has Louisiana done so far in terms of Medicaid expansion, particularly as it regards to access to healthcare services? So this is the data that comes from the Kaiser family. They do a lot of research on health insurance coverage. As you can see, one of the places that has seen the most noticeable difference in terms of healthcare coverage has been with parents and childless adults, particularly childless adults who were not at all covered before they expanded Medicare, Medicaid, and now being covered afterwards. For the parents, it had moved from 24% federal poverty level to 138 federal poverty level. So that has been quite an increase. There hasn't been much change that has happened with children or with pregnant women. So that's how that has done. So in terms of use of services or service healthcare assets, you have that pre-expansion, there were more people who were not able to see the doctor due to unaffordability of the services, and that this pre-expansion, there has been a reduction post-expansion. So it does mean that there has been an increase in access for Louisiana residents that happened after Medicaid expansion. This also is the same with people who were unable to use prescription medications as a result of costs. So you can see that there were slightly more people who were unable to afford prescription medicine before expansion versus those who were able to afford prescription medicine after expansion. So this data looks at the cumulative share of preventive care in Louisiana since expansion. This is looks at it from 2016 to 2018. This is where that data comes from, and you can see that with each year there has been an increase in the use of preventive services, and also in the use of preventive medication. So as you can see, there has been some increase in access that has come as a result of expanding Medicaid in Louisiana. So that's where we end for today's class. Please remember to ask questions if there's any part of this class you did not understand. Do have a lovely day. Bye.